The opioid crisis continues across the country and the region. Officials working on their plans to combat abuse in 2023. And Cook County certainly not immune to this epidemic.
And joining us here first at 4, Dr. Julie Nowinski-Konchak with Cook County Health with some insight into the past year and a look forward into 2023. Thank you so much for being here, Doctor. First of all, if you could run us through just how bad the problem is here in Cook County.
Sure. Thanks for having me, Anthony and Natalie. As we know, the numbers in 2021 and what we expect in 2022 are staggering. We continue to see drug overdose fatalities at alarmingly high rates, largely driven by that fentanyl is everywhere in the heroin supply at this point. So consuming heroin is more dangerous than ever.
What is the county doing to help with prevention, and have they switched gears at all to deal with just the influx of abuse?
So there's a couple of things that are happening here at Cook County Health and locally. First and foremost, when someone who has an opioid use disorder wants to engage in treatment and discontinue use or cut down on use, making treatment and evidence-based patient-centered treatment available right then and there is critical. So there's lots of efforts to make, same-day initiation of medications for opioid use disorder, recovery support services, psychosocial interventions available. Cook County Health has what we call a bridge clinic, which means that it's a low barrier, easy access entry or re-entry into care available. And state and other partners around the system and around the city and county are all working together to do similar things, to make the right thing to do the easy thing to do. And then the other thing that we are doing locally and lots of partners are doing is recognizing that there's a lot of room in between abstinence and, chaotic, unhealthy, dangerous, fatal use, and helping to embrace harm reduction and meeting patients where they're at, and making sure individuals have access to harm reduction tools such as naloxone, the overdose reversal medication, that we're talking to our patients and saying, we care about you. We care about you no matter what. And if you're consuming substances, you can do things such as not use alone. You can, take a test dose to make sure that there's not fentanyl and that you're consuming what you think. There's a lot of strategies. And then, working with partners at the policy level to embrace other tools such as thinking about safe consumption sites, thinking about things like drug defelonization and important changes that will help us, hopefully make a change in 2023.
Let me ask you this, as we kind of near the end of the year here, can you comment on what age groups or demographics this is affecting the most? Is this a problem, an epidemic among younger people? Is it older adults, or is it just kind of universal?
Yeah, Anthony, I would say, first and foremost, no one is immune from this. We're seeing all age, all races, ethnicities, all gender identities, everyone is affected. Probably everyone knows a family member or a friend or someone in their circle who has been affected by substance use disorder and opiate use disorder. We do see locally that the highest rates of fatal overdose continue to be seen in populations that are male, identify as African American, in the older, 55 to 64 age range, in neighborhoods with less resources. So, certainly we need to think about targeted interventions to that group, as well as reach all populations, and really bring persons who use substances, persons who use drugs to the table, and have them help direct what solutions should look like.
All right, well, we are hoping for a much better situation in 2023. Dr. Julie Nowinski-Konchak with Cook County Health, thank you for your time this afternoon.